Hi, I'm Felicia Beggy.
I'm Callie Burrell.
And I'm April O'Brien.
Today we're going to be doing a short presentation on management issues with concerns to impaired nursing. Substance abuse among nurses threatens the quality of care and the professional practice and standards of nursing. Substance abuse refers to both abuse and dependence and is defined as a pattern of substance use that is manifested by recurrent and significant adverse consequences related to repeated use of substances. Note that addiction is defined as a condition in which the body must have a drug to avoid physical and psychological withdrawal. Dependence occurs when the drug dominates the life of the user and the addict develops a tolerance. Once tolerance develops, the person consumes larger doses of the drug to attempt to get the same effect. Okay, now let's discuss the prevalence. Surprisingly, registered nurses have a 50% higher rate of substance abuse than the general public. It is thought that 5% of registered nurses are dependent on alcohol, while 3% of nurses are dependent on drugs. Drug and alcohol abuse decreases productivity, increases absences by up to 66%, and increases episodes of disciplinary action by up to 90%.
The leadership style, management by walking around, has been adopted by many nurse leaders to take advantage of their on-the-go aspect of the job, to monitor clinical concerns and maintain a satisfactory environment. This style provides leaders a chance to observe the staff and how they interact with patients and the family members, display interest in the staff and the work that they do, evaluate the quality of care being provided, and to demonstrate positive values by leading by example. Some of the benefits of management by walking around is time spent with those in direct patient care, gives you a good idea of the unit's strengths and weaknesses. Staff recognizes your interest in them and their successes. You are seen as approachable and the staff is encouraged to be open and honest with you. With active listening, you'll discover what the individual staff members are motivated by and whether or not they are satisfied in their current positions. You can share your vision of the unit with them and let each individual staff member know what role they play in achieving those goals. Shadowing involves following different individual staff members around for about 30 minutes and watching their daily duties. This allows you to share in their successes and to learn about the barriers that they face. Demonstrate your optimism, and that provides on-the-spot reinforcement for exceeding expectations. Now we will present a case study where we provide a scenario involving a nurse manager who uses the management by walking around leadership style. She has reason to believe that one of her nurses has been practicing impaired, and Felicia is going to tell you about her story.
A nurse manager of a med-surg unit is making her morning rounds and she discovers one of her patients to be in pain. So she looks for the nurse that's taking care of the patient and discovers her to be on break. So the nurse that's covering for the patient said that the patient had been medicated by the nurse that's on break. But that she was slurring her words before she left, and so she was a little concerned about that. There happened to be another nurse in the nurse's station that overheard this conversation and asked to speak to the nurse manager privately. And in that conversation, she said, this isn't the first time that this nurse's patients have complained of pain after they've been medicated. It's a little concerning. So the nurse manager kind of got upset and went back into the nurse's station and announced that she was going to be doing a narcotic audit and taking the nurse that's on break for a drug screen to see if she's diverting. So the nurse manager does the audit and discovers a couple of discrepancies and decides that she needs to contact human resources regarding this situation. The manager goes to the patients that this nurse has and questions them about their pain control, and the nurse returns from break and she states in front of all the nurses in the nurse's station that she needs to take the nurse to human resources for a drug screen.
Now here are some questions to consider about the previous scenario that we just went through. What appropriate nursing interventions did the nurse manager perform?
Well, she did act immediately. She notified human resources. She took the nurse's concerns seriously, and she did check for discrepancies. And she also asked the patients about their pain control.
Absolutely, I agree.
What could this nurse leader have done differently?
Well, she could have simply said to the other nurses that were concerned that she was going to follow up on their concerns, and then maybe taken the nurse aside privately and discussed her concerns with her to see, if she felt that there was a problem going on.
I agree.
What are some of the barriers to reporting drug abuse in the workplace, and what are some of the interventions that this nurse leader could do to prevent them?
I think some barriers would definitely be fear of retaliation or fear of causing your coworker to lose their job or even their license. Some other ones would probably be a lack of evidence. If they can't prove it, they don't really want to go to their manager.
Yes.
And lack of awareness of the signs and symptoms of impairment. I think that sometimes we brush it off as stress or being overtired, when in fact it could be signs and symptoms of the nurse working impaired.
Very good.
As far as the interventions, I think that the leadership style management by walking around is a good one. I think that leaders who work with that type of leadership style would sense if something was off on their unit. I also think that annual competencies regarding working with impaired nurses and the signs and symptoms of those members would be a good tool. And then creating an open and honest environment like we discussed earlier in the scenario is a good tool for interventions for working with impaired nurses.
Great.